Hello, David Jolly Muganzi is my name, final year medical student in Uganda, and also serving as the chairperson of Patient-Centered Care Movement Africa, PaCeM-Afro. Over the past 8 weeks, we've been engaging in a campaign to increase the visibility of patient-centered care concept and also get more health professional students across the continent to get interested in the idea. I want to send out many thanks to all the health professional students that have taken part in this. Over 500 of you have contributed towards the content, towards sharing, and towards the discussions we've had about this concept on our continent. Today, I want to share with you 3 main things. Number 1 is what patient-centered care is. Throughout the campaign, we have delved deep into defining the concept and its different aspects. And basically, we have pointed out that this is having our health care focusing on the patient's preferences, the patient's needs, the patient's values, and making sure that the patient is at the center of all decisions made. Patient-centered care has us moving from a place whereby patients are passive in the healthcare system to them being active members in this system. We all know that this is very good for us, especially in the developing countries where Africa lies. Studies have shown that patient-centered care drives up the quality of care. With patient-centered care, we shall ensure that the outcomes of health of our patients are better, and we shall also ensure that the quality of health provided is better. Through this kind of care, patients go through less tests, patients go through less procedures, and eventually the cost of care is driven down. This is very important for our continent due to the scarce resources we have for health. And secondly, the nature of health in Africa is changing. We are shifting towards having more age-related and lifestyle-related conditions. The WHO predicts that by 2025, 70% of illnesses shall be chronic and comorbid. And this means that we shall have patients staying in the system for longer periods. And therefore, it is important that their values, their preferences, their needs, and everything that entails them is at the center of this care. This is the only way that we shall ensure that we deliver the highest quality care to them. As a future healthcare professional watching this, it is our call to you to ensure that you have the concepts of PCC at the center of your mind as you practice throughout your career. There are 3 basic calls to action that we have. Number 1 is to the educators. Healthcare professionals can only practice what they are told. We call upon all stakeholders to make sure that these concepts are ingrained throughout the health professional education on the continent. And this is not focusing on only medical students, but every other person who is trained to be part of the healthcare system. Pharmacists, nurses, lab technicians, all these need to deliver PCC. And secondly, we call upon all stakeholders in the health sector to invest in areas that ensure that PCC is delivered, right from access to health, to the human resource for health, to the supplies for health. As the WHO directors kept saying, that health is an investment and not an expenditure. The best way for us to deliver PCC is if the health system is well invested in. And lastly, every person who is part of the health professional sector, we request you to have the mindset of patient-centered care. Right from the people who design the systems, down to the nurses that are taking care of patients every day, including the lab technicians, the doctors, and every other person. With this, we shall achieve the goal of making sure that we have optimum health in Africa. Thank you.